And we are now live.
Okay, thank you. This is Senate Appropriations, and we're continuing our work on the budget adjustment. And this afternoon, we're taking testimony from the Department of Corrections regarding their budget adjustment request. I see that we are have a number of folks from the department, including the new commissioner. Welcome. Some other familiar faces. Commissioner, if you want to start, introduce yourself and the staff that you brought with you today, and then we can get into the budget adjustment. I'm not sure who will be the presenter, or I'll let you set it up in terms of opening remarks, and if you want to then have a staff member pick it up from there, whatever works for you is fine.
Well, good afternoon.
And also, probably once Senator Sears gets on, you may have met him already in Judiciary, but we can introduce members of the committee to you as well.
That sounds great, Senator. Thank you so much for having us. And it's a pleasure to meet you, if only virtually, hopefully in person in the near future. So I'm Nick Demmel. I am the new commissioner of the Vermont Department of Corrections. This is my first time before your committee, and I appreciate the invitation to testify. I brought some of our experts with us today, and I'd be happy to introduce them now while we wait for Senator Sears to join us. I believe he's met everyone on the team already.
I'm sure.
Yeah, exactly. I have our Deputy Commissioner, Matt D'Agostino, with us, our Financial Director, Kristen Lawson, and I believe our Chief of Operations, Al Cormier, is here as well.
Familiar face.
If you will permit, I'll let Matt do a lion's share of the testimony today as our resident expert on all things budget, but I'd be happy to answer any questions that you have, or discuss any of the topics that we've included in our budget adjustment this year.
Okay. So why don't we just go around and introduce ourselves in the area of the state that we're from. So why don't we start with you, Senator Starr?
Yeah, Senator Starr, Bobby Starr from Essex, Orleans County. Glad to meet you.
Senator Baruth?
Oh, I'm Senator Phil Baruth from Chittenden County. I've met Mr. Demmel in Judiciary.
Okay. Rich?
I'm Rich Westman. I'm the senator from Lamoille.
And I see down in my corner screen is Senator Sears, but I guess he doesn't need any introduction.
Probably not, but I will apologize for mispronouncing the commissioner's name, Commissioner Demmel, several times over the last couple of months. But glad to see you here in Approps.
And I'm Jane Kitchell, and I'm from Caledonia Orange. Certainly have had connections with Al Cormier when he was in his former position. And we have obviously a correctional facility and a work camp in this Senate district. So welcome. And I guess at this point, it's been assigned to you, Matt. So we'll let you get started with the request.
Thank you, Senator. If it's easiest for everyone, I believe you already have the department's ups and downs.
Yes, I'm sure we do, but do you have a document that you want us to refer to? Are you going to screen share, or do you just want us to refer to the document?
I hadn't planned on screen sharing. I can if needed, but if you do have, we're only going to be working through the ups and downs documents today anyway. I just want to make sure everybody did have a copy of that.
Hey, Matt, it's Chrissy. I don't have a copy of the ups and downs. Could you send it to me and I can just zip it to the committee?
Absolutely.
And that way they can just open it on their computers. Great. Thank you so much.
Certainly.
Before we get into the numbers, one of the things that we certainly are concerned about, and I'm sure Al in his former lifetime, and that is an agreement that you reach with VSEA to deal with the real pressure that you're having regarding the staffing of your facilities, a lot of required overtime, weekends, difficulty filling vacancies. And I know that in some maybe all areas. Probation officers are being called on to assist as well. I was just wondering if you could just give us a little background about that agreement that the department reached with the union regarding, I think it was both on the salary side as well as some bonuses, and the extent to which, what has been the experience to date in terms of the impact that it's had. I don't know who wants to pick up on that, Matt or Al, whatever.
I'm happy to take that one, Senator.
All right, thank you.
You're welcome. Al Cormier, Chief of Operations for the Department of Corrections. So our experience with that side letter, I think it has certainly helped us with retention. We've seen fewer staff leaving. Our recruitment numbers, we continue to see a steady increase in the applications coming through the state system. We're currently at 15 in our current academy. And we've been right around the 16, 17 mark. One thing that we do have right now is we have 5 community correctional officers in with our regular correctional officers. So we're seeing some recruitment strategies coming from both the field and the facility, which is good. That side letter is an agreement for sign-on bonuses for new staff that will be attending the academy. The total, I believe it's $1,500 at the end of 1 year. It's paid incrementally. So that covers the sign-on bonus, and then the salary component of that is anybody that is working in a correctional facility and completes an 8-hour shift receives a $50 payment for every 8 hours worked. So basically it comes down to $6.25 an hour raise for all staff that are working inside of our correctional facilities.
So what was the price tag for that agreement then, for those wage increases and bonuses?
Matt will have that number.
So the total amount of the entire DOC incentive package through the side letter agreement is approximately $6.5 million, and a portion of that is, a piece of that is in the budget adjustment. So we'll get to the specifics on that. I could break down for you kind of what each of the bonuses amounts to in total and what those are for.
All right, thank you. That'll be helpful. The reason I'm asking this, of course, is early in December, I was put into the whole pension discussion for state employees and for teachers. And so one of the concerns is how to, and they were looking at the retirement system in terms of how retirement benefits in Vermont compared to neighboring states. And so we're going to continue to look at that because we're running up against a deadline on the task force report. And some people have commented, well, when I'm being recruited and I'm 25, I'm not worried too much about, my retirement. On the other hand, you would worry if the contribution level seemed to be kind of high. And so how to make that calculus work. And so I was just wondering, generally when you're recruiting at the front end, people are looking more at what's my current compensation and why would I take this job over another job that might be available in this labor market. So it seems like there are a couple of pieces at work here, and that's part of why I was hoping to understand better what had already gone in place for on the front end and what the cost was on that. So it's over $6 million. Okay, thank you. That's helpful. I may be repeating information that you already got in justice in the Judiciary Committee, so I apologize, but I think it's important that we understand that, and I guess it's going to connect to the budget adjustment anyway. So why don't we get started on that, Matt?
Certainly. A few items to go through, most in the correctional services appropriation. First one that we have is a technical adjustment. It relates to justice reinvestment funding coming from the out-of-state savings from fiscal year 21, where we had $417,030 that was remaining in funds from last fiscal year. This is just a technical adjustment to move those funds that the department already has from the out-of-state appropriation to the correctional services appropriation, where there'll be contracts, grants, other expenditures will be from that particular funding source.
All right. Senator
next-
Sears will pay close attention to that because we obviously were concerned that there was a fence around those savings to really make enhancements with our system here in Vermont. So Senator Sears, you're all set on that? I lost him.
Questions? I have a couple of questions about out of state. And I recognize that the numbers haven't gone down as we might have anticipated because you've had COVID and staffing shortages, which have forced you to keep people out of state. Do you have any projections of the numbers that would be out of state today if not for the staffing shortages and the COVID situation where you've had to isolate? I know I got a message from today that there's been a new outbreak in St. Johnsbury, or a large outbreak there. And, obviously there's no place easier to transmit than in a correction facility or a nursing home, any kind of congregate living situation. So I'm curious if you folks have kept track of that. So that I think I've had a lot of questions about that from constituents actually, and it wouldn't be a bad thing to put out in kind of a press release. We're making great progress in reducing prison numbers, but we usually see them through things like reduction in out-of-state beds.
So your
If you don't
question
have
is
that
the extent to
today-
which the out-of-state bed census is higher than it would be if we didn't have COVID and have limitations on who could be housed here in Vermont facilities.
Staffing
Okay.
situations. Does anybody have any, is that something you could put together for us if you don't have it off the top of your head today?
Senator, I think that's something that we can certainly look into. I can tell you the current out-of-state population is at 137 today. And so that is down considerably from where we started the pandemic. And I think well the struggles and the challenges we face here in the system. It's not only the staffing issues that we face, so that's a huge part of it, but it's also the reconfiguration of the facilities to have isolation and quarantine spaces so that we can take people out of the general population in order to house them separately to prevent the spread of the illness through facilities. All of that contributes to our inability to free up more beds in the system here in Vermont. But, I think we've said before, and we'll continue to say, it's in everybody's interest to get those individuals back to the state. They belong here in Vermont, and we'd like to find a way to do that. I'm not sure that we've done projections to determine where we would have been with COVID not being a factor. Maybe Al, if you could weigh in on that point, but it's certainly an area that I think we want to study closely, and we'd welcome your input on that.
Yeah, it isn't something we have collected data on. Our population has dropped as a result of COVID. One with our own releases that we did at the onset of COVID. The other factor to take into account is the closing of the courts. We have a backup with the court system. So we can say, had it not been for COVID, we would not have quarantine and isolation units, and we could bring 137 people back. But the reality is we don't know that because we don't know what the court system would look like without COVID. So I don't think our population would have dropped, and we do expect it to go up. We continue to see those numbers increase, especially in our detainee population.
Well, it just, okay. Well, I mean, when we try to look for the benefits of justice reinvestment too, and the potential savings there, it's usually guided by what are our out-of-state numbers. And obviously, women can't go out of state. So even those numbers are much lower than they would have been otherwise. But I'm not sure there's tremendous savings because you still have the facility, you still have staff, all kinds of other costs. So it's been relatively easy to figure the out-of-state beds, subtract what it was or would have been, and go from there. I'm appreciative of the challenges that you all face. But I'll reserve a couple of other questions about some of the challenges for a little later in the presentation.
Okay. Obviously, your big request is the next one coming up, and that has to do with the agreement that you reached relative to the salary and the bonuses, which is just about $5 million.
Correct. That item, as you stated, the DOC incentives for the shift, retention, and hiring and academy progression bonuses, $4,917,560. This is the portion that the department does not have funding for. We do have carry forward funds totaling $1.6 million that makes up the additional amount of the roughly $6.5 million total for this. So as I said, if you want a breakdown of what this looks like, there's retention bonus payments that were issued already, the first of two, to staff, $1,000 for each of the staff in the corrections and supervisory bargaining units within DOC, and the total amount with payroll, with the benefits, the payroll-driven benefits, for that is about $2.2 million. We also have new hire and academy progression bonuses starting at the time of hire with a $250 bonus, and then progressive bonuses at completion of academy, the 6-month original probation, and the one year of successful completion of service bonuses at each of those that amount to an estimated total of $226,000. This is based on what we projected for new hires during this particular period of the side letter. And then finally, and the largest component of this is the shift and standby bonuses that Al had talked about earlier, the $50 for shifts that are being worked within facilities for security roles. And that totals approximately $4.1 million.
So what we're seeing here is you had a little bit of carry forward that brought it down from the 6.5 to what's being requested here. And it's to fund that side agreement to deal with hiring and retention, recruitment and retention. Questions? Yes, Senator Starr. You're muted though.
Maybe how will our salaries compare with other salaries of comparable workers around the state or even out of state correctional departments? Has that been checked?
That specifically hasn't been to my knowledge as part of this. With that said, when you say out of state, are you talking in general the other states correctional departments,
Yeah,
or specifically to the out of state program that we contract for?
no, out of state correctional departments, from New Hampshire, say, or Maine.
You're talking about state employees comparability.
Yeah.
It's a good question. I think some others on this call probably could speak to this as well. We have some neighboring states that have federal prisons as well as the state systems that the compensation levels in those states, we've long struggled with parity here, where there is a higher starting salary and higher compensation to a lot of those neighboring areas for similar work. So yeah, in the sense that this increase is that $6.25 an hour for the security staff, that makes up a large gap in terms of the difference between the compensation in other places versus Vermont state staff.
Yeah. Well, thank you.
So $6 plus against the normal, what percentage is it of what they would have received without the enhancement?
It would all depend on.
I know it would all depend
tenure.
on years of experience, et cetera, but
roughly, so for the starting salary for somebody who is brand new on kind of day one out of the academy, they're earning just under $20 an hour. So it's a fairly significant percentage. Somebody
Okay.
who's perhaps been with the department for 10 years in that role, it's still a large percentage, but less so. They'd be in the possibly 25 to almost $30 range for hourly.
All right. Other questions that the committee might have? Senator Sears?
My other questions really revolve around, excuse me, the use of probation officers in the correctional facilities and how that might impact, the local probation departments and the ability to supervise offenders in the community. I know that many have concerns about probation officers working in the facilities, but I'm sure that they are trained and many of them used to work in facilities, but I'm concerned about the level of supervision in the
Yeah, I think Al probably has some comments to add here too, but Senator, what I would say is, as you're likely aware, as we look to augment the security staff in our facilities, the first place we turn is to our probation and parole offices, because many of those individuals have the security background, they have the necessary trainings to be able to do that job effectively and safely and within the criteria that we look for in those officers. And so you're right, that is kind of the first bucket of staff that we look to when we need to augment the security staff at the facilities. I think the other view on that is the individuals that are in custody within the facilities, certainly we need to maintain the security of those facilities, whereas the individuals who are out on supervision, there is already a level of trust placed in them, and certainly they need supervision. But if we are going to draw back on some service that we provide across the system, we can't afford to give up the security and safety of the facilities, but I think we can draw down some of the supervision that we do. And obviously that's nobody's preference, but we're faced with this reality of trying to maintain the system's integrity. And I think it's the best way we've found so far. And so I share your concern that we don't want to be drawing back too far on the supervision of individuals out in the community, because certainly there are safety risks incumbent in that as well. But it's a trade-off that we have to make sometimes in order to maintain the system and its continued effectiveness. But I'll pause and let Al weigh in if he has any other comments that might address your comment.
Thank you. So we did reassign a number of community correctional officers for a significant amount of time. Those community correctional officers were taken away from their job in the field and reassigned to those facilities. We've since brought them back to the field to allow for them to do the community supervision. When they were reassigned, the probation and parole officers were doing enhanced check-ins, meeting standards through phone calls, video visits, office visits, all while still trying to mitigate the effects of COVID. One decision we had made early on was to limit home visits because we didn't know what we were walking into, even with PPE being available. A lot of the probation and parole officers now that are working in the facilities are doing so after hours. So it's overtime for them. It's nights and weekends. So it's not that we're pulling them from their job and saying, you are in a facility now. They're still doing their regular job. And then this is an addition to. Many of our staff are on a standby status to help cover hospital coverage. So when we have to send a incarcerated individual to a hospital, the probation and parole office, to include the POs and the CCOs, are covering the majority of that for us. Well, we would historically utilize a correctional
So
officer.
is there mandatory overtime? You're talking about your probation and parole officers doing their regular job and then adding on to it. Is that a mandatory assignment?
Not with the probation officers or the community correctional officers. That is voluntary.
I see.
Mandatory overtime only applies to the correctional officers in the facility.
All right. Uh-huh. Well,
Well, thank you,
And-
but
Yeah.
I'm concerned. My
As are we.
My experience tells me that when we're not supervising certain people, they will do things that they may not otherwise do, because they're testing the limits.
Mhm.
Lack of a
so
better-
they are doing that. They are doing that community supervision. That is what we, as of now, it's not as though they're substituted one job for another, that they're doing. Okay. All right.
Okay.
Well, Senator Sears, used to be in corrections. Maybe he would like to, we could see who we could round up here. Senator Sears, would you like to get back into the workforce?
Nothing more than going back behind bars.
I know when
No,
when that door closes, I know a lot of people have a very strong response, that's for sure.
Yep, and I think I'd have a stronger response today than I did when I was 29.
Well,
I was thinking about that the other day, how times have really changed.
well, the population has also changed because of
Yeah, it's much more
policies and
violent.
diversion. And so
Yeah.
who's incarcerated today is so different than 25 years ago.
Mhm.
Yeah.
And when, back when Harold Stevens was there. Now we're really
God,
dating
you're
ourselves.
you're getting yourself really dated.
I know.
I bet we're the only two in the room who may know which Harold Stevens was.
That
Maybe
Al
Al.
doesn't know.
Never worked with Mr. Stevens, no.
He was, I think it wasn't at Newport that he was the probation parole head of the.
Yeah, St. Johnsbury.
Or St. Johnsbury. Okay.
Yeah,
Yeah, well,
Mm-hmm.
he was,
he was, he was quite a presence, shall we say.
yes, he was.
But that's ancient history. And actually, we predate even the development of the regional correctional facilities
Yeah.
back when they had the county
You
jails.
know,
So,
but speaking of Harold, he was well dressed.
yeah, he was a dapper fellow.
I'm sure
other,
that like Bobby, he'd give his clothes to Richie.
Well, Commissioner, you're getting some ancient history here. There's some of us who have very long institutional memories. And so I hope we haven't bored you too much with our trip down memory lane. But obviously, the world that you're dealing with today is different. And some of our policies, it's, I think, in terms of who is getting incarcerated now, the policies to support in the community. I want to go back. This isn't related. Your budget adjustment's pretty straightforward. And that had to do with the move away from the more congregate living or group living into apartments and more normalized community settings. And I know that there was some surprise and concern about that move. And I wondered if you could just speak to the experience to date. I don't know who wants to pick that one up, but.
Do you mean within the facilities or when individuals are out on supervision and finding the transitional housing?
I'm talking about, for example, Dismas House or those sort of transitional housing. And so some of the money that you contracted out, I think it's in the beginning of July, was done in a different way. And there was some concern expressed at the time as to programs or that weren't getting funded. Senator Sears, can you help fill in the blank, or am I doing adequate work here?
No, what's happened, and we've had a lot of complaints as you might guess, about the loss of the congregate living situations in return for the kind of pathways independent living apartments that we went, well, it happened in July, I believe.
Right.
And one of the concerns is the loss of drug treatment beds with the Dismas House and some of the others. That and obviously there was a program here in Bennington for 14 beds that closed, is now being used by 1 or 2 DCF youngsters. But no, it was a major change. My understanding is, and I got in a little bit of an argument with the folks at the Justice Center as well as
I think Commissioner
Former
Baker
Commissioner
was
Baker,
talking about
yeah.
the reason they were doing it was, you know,
Well.
that was the evidence that would suggest. Our concern is that some of us who have also been around a long time remember when there was that great move to put inmates into the community. And there were 2 or 3 individuals that might be in apartments, but there wasn't not much in the way of supervision, and the communities and the experience was not particularly positive. And so I think we also wanted to make sure that, you know, we learn from past experience in terms of what it means to be in the community and how to support that presence in a way that you're maybe you can say they're in the community, but they really are not part of the community, or they in fact are viewed in a very negative way by the rest of the community.
Yeah, I can speak to that a little bit. I remember the housing. I was a community correctional officer at the time when we had the DOC housing, and it wasn't a good program. And I think we did learn from that. And this is completely different. The theory of change model that our staff went through in developing the criteria and the new RFP that went out and the housing providers that were selected really took a look at dependence and collaboration with a lot of the designated agencies in the community, because we know this isn't just our problem, that we really need to work with the substance abuse providers and mental health providers and agencies within the community that can help these people succeed. And what we were seeing was not a high success rate in the congregate living, as there was often that codependence on others to support them and helping people get out and into their own apartment and really give them the tools and assistance needed to survive on their own is part of reducing that recidivism rate. And a lot of the work that we did came from JRI and the recommendations out of that group as well. We have seen some, I think it's too early to say we've seen success. We're only 6 months into it, but we have not been concerned about any of the outcomes that we are seeing right now.
And that would be part of that community reinvestment and policies.
Mhm. So right now it seems to be working well.
All right. Well, it's good to have at least a preliminary sense that it's was a good direction to take.
Mhm.
Any other questions from other committee members? I guess Senator Sears and I are.
yeah. Well,
So,
Yes, Senator Westman.
so I don't have to have the answer now, and I'm sure Senator Sears will go in this, but I would, when you come back to do your full presentation, you know, we all know the staffing issues in correction are terrible, and I would like to understand it myself better. So when you come back for your presentation, if you can talk about that. I know a couple of people that the amount of overtime they're working in corrections is untenable. And I know you don't have any opportunity to do anything different than that, but I I know personally some people that live and work in correctional facilities around me that they're at the end of their rope and they're very good employees.
Yeah, thank you for those comments, Senator. I would welcome the opportunity to come back and discuss the staffing issue with you. And I think recently we've done a lot of work to try to plot out graphically what the staffing challenges look like as a means to better understand it and better tell our story and how dire the situation is. And the circumstances that you describe about the individuals, you know, that's not unique. It's not, oh, those are just the friends of Senator Westman. Those are the stories across the system. And so it's something we very much need to look at. Certainly, you know, we're in front of the Senate Appropriations Committee. We'll never turn down money from you all to help us with that problem. But what I firmly believe is it's not just a money problem. The side letter was a huge infusion of money to our team, and that's worked well, but that's not enough. And money isn't going to be the thing that solves this problem. We've got to find other ways to draw staff in, new staff, recruit new staff, but also retain the excellent talent we have. And we're not going to be able to do that until we can draw down some of these overtime requirements and the amount of hours people are working. So yes, Senator, to your question, I would welcome that opportunity.
Well, I would say in what you're paying in overtime, it's a huge budget item for us. And
I'd want to retire right now because it would talk about 3 highest years. We're hearing salaries in excess of 100,000. So if you have a couple years, you really it does have it's torture, but it does have a very and that we used to call that spiking. And it used to be done by some employees deliberately, but obviously it's out of necessity as far as your staff. It also raises the question about how the job is defined, or whether there should be rotation, or how to I don't know whether there's some ways that the job, the stress somehow can be mitigated, and through some more creative thinking in terms of how that job could be constructed differently. But that's not for us to decide in the budget adjustment, but it does mean it's a very difficult job. Not the only one. Certainly when you look at people who are in child welfare and other areas of state service, they're these jobs that are so critical to public safety are always a challenge. So and then the fact of the matter is, every area of our workforce, there's a shortage. So it just makes your situation, it just makes it worse. But certainly in nursing, I mean, it's just all over the board. In terms of everybody's competing for an inadequate supply of workers, and the better the pay, or depending on the job, can make a difference. So I'd just say in that they're down to a place where they can't just let people out of jail, out of the correction facilities, so they have no choice. But maybe it could be full employment for legislators. We could all get trained and supplement the workforce, huh? I bet there'd be people that would like that. To do it to us.
I will say, if he charts it out and brings back in the context of the FY23 budget, so we had a better understanding, that would be helpful for me.
The other thing, maybe then we'd have more experience too in terms of the impact. Have we had some impact on that overtime demand? How are we doing? Has the vacancy rate stayed? Has it gone down just a little bit? We're hearing, obviously, mental health agencies are really struggling with high vacancy rates. It's just permeating so many areas of critical service. So I don't even know where there's a surplus of labor, to be honest. But if you have any data that can help us see what $6 million has done might be helpful as well as we get more experience. When did that become effective?
The side letter agreement went into effect on August 29th of 21.
Okay, all right.
And it remains in
So-
effect through March 12th of this calendar year. However, that includes the final pay period in March. So effectively, it's effective through the end of March of 22.
Right, well,
I
you
know
may
I
be
feel-
back.
Feel like I'm kicking a dead horse, but the need for mental health treatment, both in the community and in hospitals and so forth, is acute right now. And I realize that many people get sent to correctional facilities because you're the institutional last resort. But it's really incumbent upon us to focus this year, I think, on making sure that our mental health system at least gets. I had a meeting with the local hospital this one day, and DCF was there, but not DOC. But, you know, people being held in the hospital because there's no place else to go with mental health needs. We have and I don't know what the numbers are right now of those being held in corrections or being supervised in corrections who are really significant mental health issues. I imagine it's quite high. And until we deal with that, we're still going to have some of these problems because many of the people are acting out due to the mental health problems. And the second is the juveniles who are under 18 or 18 and 19 who are serious, violent offenders who need placement. My understanding is Sununu is no longer available. I think we're going to have to bite the bullet and look at 4 beds at Marble Valley, even though I know corrections don't want to. But I really think it's going to be necessary in order to protect.
4 beds at Marble Valley, is that what you said, Senator Sears?
Yes, I did. There was one individual held at Marble Valley, a 17-year-old. You have to be separate by sight and sound. I know it's difficult. When they released him, he went to a community-based program. He then assaulted staff there, damaged a lot of property, ended up at the local hospital. They held him for a few days in an isolation room, in the emergency room. He assaulted staff at the hospital. He assaulted I know nurses, but I'm not sure about a doctor. And this is not atypical. And I realized that, we have to face this problem as a state. And I just, unfortunately, I shouldn't even be suggesting this, but because the Brattleboro Retreat is not accepting new patients because of COVID. And, you're the institutional last resort.
And let me ask, if you had the 4 bed, I know we have to keep them separate, but that adds additional staffing demands that I would think on top of everything else, I would think that would require additional staff is when you've got to keep the juveniles separate from the other population. I'm just assuming that would be would be the impact, is it adds even more pressure on your staffing demands.
It does at that facility, but it also creates a situation where we often have to move individuals around the system, which creates transport issues and adds to populations of the place. There are a variety of reasons that housing a juvenile, even 18, 19, in some instances in the correction system creates a litany of problems, not just for the system, which we obviously are concerned about, but also for the individual. You imagine a juvenile, particularly under 18, with sight and sound separation by themselves in a unit for long periods of time, and the mental and emotional toll that comes along with that, essentially almost like a solitary confinement setting, because of the requirement for sight and sound separation. And in Vermont, where the system's so small and we have so few juveniles that would fit into the correction system, there is nobody to house them with. And so, it's a horrible situation, I think, that we'd be dealing with, but certainly it's one that we want to be an engaged partner with our colleagues at DCF, who are also very concerned about this situation, with you, Senator Sears, and the others who are concerned about this, and hoping to work with you all to find a good solution to that
Well,
problem.
I wish there were a better way, and I'm not suggesting that you're the ideal. Your correction is far from it. We're trying to move away from that, but there's a certain level of dangerousness that communities protection from. Mental health facilities are non-existent, as are the DCF facilities, because when we closed Woodside, there was the promise of Newberry, but the promise of Newberry is now at least a year or more away, if ever. And so DCF is scrambling to find beds. They're being, obviously it's like a perfect storm with COVID impacting the ability to take people. Sununu is not an ideal location. And, the description of my local hospital and the emergency room, those beds are isolated. There's no windows, and kids are held there 3 to 4 or 5 days because there's no place else to put them. And that's the hospital, becomes the institutional last resort. And they can't deal with that. They don't have the security really to deal with it. Becomes the police problem, becomes the problem of the state's attorney charging them with crimes of assault and violent crimes. So it's a situation that we need to really be cognizant of and take care of this year. It can't wait another year for Newberry to maybe open. So I'm, if I have no other goal this year, is to try to protect our community and our community programs that are not able to handle this level of violence.
Well, we've kind of gone way beyond budget adjustment, but I think it gives you a sense of what is weighing on our minds in terms of both the workforce, the work demands, and what it means for the correction system, which really becomes a system of default when the last place where if they're not in the emergency room, they're oftentimes in your facilities. So there's a lot of challenges here, but we're going to have to put our heads together, because what we have right now is certainly just being cobbled together in the short term. So unless we have further questions for the folks from DOC, I am going to suggest then we, Chrissy, this is it for today, right?
That's correct.
Okay, in terms of testimony.
Yes.
So I'm going to adjourn the committee for today, and thank the folks from Corrections for coming and being so forthright in their information. And we look forward to additional information when you come back with your budget presentation. And of course, you'll have lots more time probably with judiciary as the session progresses. So thank you.